This video, and its associated YouTube shorts, are focused primarily on the most serious potential adverse events, or side effects, of this product. These selected highlights do not include all the information needed to use this product safely and effectively. The information presented is sourced from both the manufacturer's consumer and healthcare professional websites, as well as the FDA Approved Prescribing Information. You can review this information yourself, in full, by following the links provided below in the description section of this video. There are risks and benefits with the use of every medicine or device. Generally speaking, users who experience serious side effects of any medication or device should contact your healthcare provider or seek medical attention immediately. Always consult your healthcare provider before stopping or making changes to your medications. Georgetown University's Health Policy Institute reported that 66%, or 130 million adults in the United States, take a prescription drug. There is no doubt that these drugs have helped millions of people. And it is generally understood that all FDA-approved products have both risks and benefits. However, these are not always thoroughly explained to every patient or their caregiver. In fact, the independent think tank Nuffield Trust reported on several hospital surveys conducted with their patients. The patients were asked if a staff member had told them about medication side effects to watch for when they went home. Of those who answered the surveys, 40% said they were not told while in the urgent care center or the ER. And only 28% of hospital inpatients stated they received an explanation of the potential side effects. Patients have the right to know about the side effect profile or the medications they are being asked to take, because they can have a severe negative impact on their health. According to the CDC, adverse drug events cause approximately 1.3 million emergency department visits each year. Of those, about 350,000 each year need to be hospitalized for further treatment for adverse drug events. A 2014 Harvard University article by Dr. Donald Light stated, quote, "About 328,000 patients in the U.S. and Europe die from prescription drugs each year." With this lack of education for the patient, it is even more critical to know when a medication has potentially serious or even life-threatening side effects. That's why the FDA warns patients and healthcare providers about these potential issues. They do this by issuing a specific type of warning called a black box warning. Pharmafactz.com states that a black box warning, often referred to as simply a box warning, is the strongest warning issued by the FDA in the United States on drugs that carry specific health risks, serious or life-threatening adverse effects. The Cleveland Clinic further states that a black box may also be used to communicate important instructions for safe use of the drug. And the National Library of Medicine advises that there are over 400 different medications that have black box or box warnings. So that begs the question, if there are over 400 medications currently on the market with black box warnings, how frequently are they prescribed to patients? Well, according to the Pharmacy Times website, one study found that within a 2.5-year period, more than 40% of patients received at least one medication that carried a black box warning. The Saxenda consumer website states that the most important thing you should know is that it may cause serious side effects. At the top of the Saxenda Prescribing Information document, the FDA has alerted the reader by using a black box warning entitled, "Warning, Risk of Thyroid C-cell Tumors." According to the manufacturer's website, in studies with rats and mice, Saxenda and medicines that work like Saxenda cause thyroid tumors, including thyroid cancer. It is not known if Saxenda will cause thyroid tumors, or a type of thyroid cancer called MTC or medullary thyroid carcinoma, in people. Nevertheless, doctors are instructed to counsel patients regarding the potential risk of MTC and the symptoms of thyroid tumors. They include getting a lump or swelling in your neck, shortness of breath, and hoarseness or trouble swallowing. In addition to the black box warning for the risk of thyroid C-cell tumors, Saxenda has 8 other possible serious side effects. Number 1. Pancreatitis. Liraglutide is an ingredient within Saxenda. And the manufacturer's websites state, in part, that acute pancreatitis, including fatal and non-fatal hemorrhagic, or necrotizing pancreatitis, has been observed in patients treated with liraglutide. You may feel the pain from your stomach or abdomen area to your back. The user is instructed to stop using Saxenda and call your healthcare provider right away if you have severe pain in your stomach or abdomen area that will not go away, with or without vomiting. Number 2. Gallbladder disease. According to the manufacturer's website, substantial or rapid weight loss can increase the risk of gallstones. However, the incidence of acute gallbladder disease was greater in patients treated with Saxenda than with placebo, even after accounting for the degree of weight loss. The Saxenda consumer website also alerts users that some gallbladder problems need surgery, and they are directed to call their health care provider if they have any of the following symptoms: pain in the upper stomach or abdomen, if you are running a fever, if you are showing a yellowing of your skin or eyes, or if you observe clay-colored stools. Number 3. An increased risk of low blood sugar or hypoglycemia in adults with type 2 diabetes, who also take medicines to treat type 2 diabetes, such as sulfonylureas or insulin. According to the manufacturer's website, users are advised to check their blood sugar before you start taking Saxenda. Some signs and symptoms of low blood sugar may include shakiness, sweating, and headache, feeling drowsiness or weakness, if you experience dizziness or confusion, hunger or irritability, if you have a fast heartbeat, or you're feeling jittery. Number 4. Hypoglycemia in children. There is a risk of low blood sugar or hypoglycemia in children who are 12 years of age and older without type 2 diabetes. Again, the manufacturer's website advises users to check their blood sugar before they start taking Saxenda, and while they continue to use Saxenda. Also, they should be aware of the same signs and symptoms of low blood sugar previously mentioned. Number 5. According to the manufacturer's websites, Saxenda can increase your heart rate while you are at rest. It instructs users to tell their healthcare professional if they feel their heart racing or pounding in their chest, and it lasts for several minutes. Number 6. The manufacturer's website acknowledges that acute renal or kidney failure and worsening of chronic renal or kidney failure, which may sometimes require hemodialysis, have been reported, usually in association with nausea, vomiting, diarrhea, or dehydration, all of which Saxenda may cause. Dehydration may cause kidney failure, which can lead to the need for dialysis. This can happen in people who have never had kidney problems before. Users are instructed to call their doctor right away if they have these symptoms or cannot drink liquids by mouth. Number 7. Serious allergic reactions. According to the manufacturer's website, reactions such as anaphylaxis and angioedema have been reported in patients treated with Saxenda. Users are warned to stop using Saxenda and get medical help right away if you have any symptoms of a serious allergic reaction, including swelling of your face, lips, tongue, or throat, problems breathing or swallowing, having a very rapid heartbeat, feeling dizzy or fainting, or severe rash or itching. Number 8. According to the manufacturer's websites, users should pay attention to any mental changes, especially sudden changes in their mood, behaviors, thoughts, or feelings. Users are advised to call their health care provider right away if they have any mental changes that are new, worse, or worry them. Responsible healthcare providers will always educate their patients, or caregivers, about the possible side effects of this product and all others they prescribe. In particular, those which carry a black box warning for potential serious or life-threatening side effects. This video has only touched on a small portion of this product's approved label. There are studies listed in this product's prescribing information that have shown additional side effects. And the highlights mentioned in this video does not include all the information needed to use this product safely and effectively. Therefore, links to the complete FDA label information and manufacturer's product website have been provided in the description section below. We highly encourage you to read these documents in their entirety and refer all questions to a medical professional. In addition, we hope this information will help you have a better understanding of the potential side effects associated with this product so you can have a more informative conversation with your healthcare provider. In the Saxenda playlist, you can find an abbreviated short video for each side effect mention. And please do share this video, or one of the respective shorts, with those who you believe might benefit. Due to the lack of allowable space in the description section of YouTube videos, you can find a link to this channel's video entitled Channel Disclaimer Information in the description section below. This will provide you with both our full disclaimer and contact information.